This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
I'm Matt Weinstein. I'm one of the PGY4s at USF. I'm joined by my co-chief resident, Stefan Litzenberger, and then one of our third years, Kareem Casey. So we'll be presenting today. Just to start off, just our program leadership. Our program director is Dr. McCarthy. I'm not going to read through all her credentials. You can see them here. I will highlight some stuff that's not on this slide, however. Dr. McCarthy as a person, very personable. As a program director, she's extremely innovative and really values resident feedback, which makes being a resident here a much nicer experience, to be honest. Her office is right next to our resident room, and her door is always open. So she's really available anytime to talk to us, whether over phone or in person. We even go to her house 2 to 3 times a year for food, drinks, and kind of update her on rotations and things with the program and whatnot. And then Sharina Farrington, she's our program coordinator. Y'all can reach out to her with any questions about rotations, etc. So the 3 main clinical sites we rotate at are the VA, Tampa General, and Moffitt Cancer Center. The nice thing about these is they're all close to each other. The VA and Moffitt Cancer Center are right across the street, and then Tampa General is about 15 minutes south of both of those facilities. So those are the 3 main ones we're at, along with a few others that we'll highlight. So program overview, basically, of what you'll be doing. Our first year is all at the VA. We do 4 months of medicine wards, which are obviously more your busier months. However, the nice thing about our program is our first year has a lot of PM&R relevant rotations mixed in. So for example, I'll highlight we do an orthopedic clinic rotation where basically you're just doing blind injections all day. So you get all your blind injection numbers that month. And then we also rotate, you can see on the slide some other PM&R relevant months that we do: neurology, infectious disease, etc. Your second year is mostly at the VA. You do your core PM&R rotations in SCI, TBI, and polytrauma, and general rehab, and also a couple procedure rotations in EMG, and then our ultrasound guided injection clinic, where you get comfortable with doing ultrasound injections and diagnostic ultrasound as well. And then you also do a month at Moffitt Cancer Center for palliative care. And then the USF Concussion Clinic is mixed in with our TBI rotation. Third year, you're split up between the facilities I mentioned earlier. So Tampa General Hospital, you do consults there, pediatrics there, some outpatient clinics. The Tampa General Rehab Hospitals, where you do adult inpatient with the whole PM&R patient population, TBI, stroke, all that. So, and then Moffitt Cancer Center, we do interventional pain there, and also a neurosurgery rotation, which is kind of unique because the attending we work with there does some pain procedures as well. And then you're also working with surgical TBI patients. So you get hands-on experience with doing procedures like kyphoplasties and whatnot. So it's very unique to our program, and it's honestly a really good rotation. And then again, VA for some more the standard PM&R rotations. And then we also, a recent addition is we rotate through a private practice pain group called Florida Pain Medicine. So we do a month our third year and a month our fourth year there. So lots of procedural time there. And then fourth year, we add in some amputee O&P stuff at the VA. And then the nice thing another nice thing about our program is the 4 months of elective time, which is a lot. So James A. Haley VA, I mentioned that you're here a good bit. I know VAs sometimes can get a bad rap depending where you are. However, the VA here is consistently a top-ranked VA hospital system in the U.S. and particularly the rehab side of the hospital where we work at is very nice, very modern looking. You can see in some of these pictures. I think it was built sometime in the 2010s, so relatively newer. It's 56 beds. We have a TBI and polytrauma floor, and then a general rehab floor with amputees, joint replacement, strokes, spinal surgeries, cardiac patients, COVID recovery, etc. And then also obviously an SCI unit. We're actually a model system for SCI, and then we're also an amputee center of excellence. And some unique things about being at the VA is they get a lot of equipment that's not available in the private world because of insurance purposes. So at our VA, we have access to virtual reality for rehab, vestibular rehab, aquatic treadmills, adaptive sports. It's a pretty cool experience. And then these are just some pictures of the VA. You can see it's very modern looking, nice, some of the PT equipment we have in there. Tampa General Hospital, this is another site you'll be at your 3rd and 4th years. So TGH is ranked #1 in the state of Florida, number 36 in the US for rehab per the 2021 US News and World Report. It's over 1,000 beds, level 1 trauma center. It's one of 5 burn centers in Florida and one of 2 pediatric burn centers. So that's pretty unique. We get to work with some burn rehab patients. It's a big transplant center. We get experience with VAD management with the cardiac patients. And here's where you'll be doing consults, pediatric consults and inpatient, and also some outpatient clinics. There's 9 peds beds, and then the adult rehab beds are now at the new Tampa General Rehab Hospital, which we'll get to, and I'll throw it over to Stefan Litzenberger.
Yeah, so this is our, like Matt said, the rehab hospital that's affiliated with Tampa General. It's got a unique partnership with Kindred Rehab Services. We just opened up back in May, so it's definitely got the latest and greatest of technology and equipment there. There are 80 private patient rooms, which are all very nice, and patients obviously love being in their fancy private rooms compared to like crowded acute hospital rooms. We also have a nice secure unit, which obviously we'll use for those patients who are at risk of wandering off, like TBI, stroke. We've got a transitional living apartment, which is great for their therapies, multiple gyms. We've got an outdoor courtyard with different activity spaces. All different types of specialized programs for different injuries and amputations. Really is a great place for our patients to rehab, and from a resident standpoint, it's a fantastic place to train. We also have internal medicine support and other specialty support there as well. So any complications that do arise, we do have help there. And then obviously, because we're partnered with Tampa General, we've got easy access to any emergency services that we might need as well. Can you go next slide? And like Matt was talking about, Moffitt Cancer Center, this is, it's a top 10 cancer hospital in the nation and has been for a long time. And there's a lot of different services here, 200 beds, like we talked about in the curriculum. We do interventional pain here. And because we're dealing with both cancer and non-cancer pain, we have a huge variety of different procedures, nerve blocks, stimulators, basically any type of pain procedure you can think of, we'll do here. We have our neuro-onc service as well that we're a part of. We do get pain procedures there as well. And then we get exposure, like Matt was saying, to a lot of surgical interventions that we may not be able to do necessarily after we're done with training, but we do get that hands-on experience to kind of see what happens in the OR and how we can better rehab those patients once they get out. And then there's also our palliative care service, which in a cancer hospital is to be expected. And we get a lot of symptom management, opioid management training there. And then Florida Pain Medicine, this is our private practice that we've partnered with that Matt talked about. This is predominantly an interventional pain clinic. There are several sites kind of throughout the Tampa Bay area, though a brand new ambulatory surgery center is opening up later this year, and everything's going to be kind of consolidated to that surgery center. We do spend a couple months here. This is also a training site for the USF Pain Fellowship. So you will have a great opportunity if you're interested in pain or spine procedures to get some additional education from the fellows and to talk to them about opportunities there. And this is where we're going to get some exposure to a lot of kind of the cutting edge technology that's coming through those private practice clinics. And minimally invasive procedures, obviously your bread and butter stuff, epidurals, nerve blocks, radio frequency ablations, and you'll get a lot of fluoroscopic experience here. And Florida Pain Medicine is also involved in a lot of different research projects that you can certainly get involved in if that's something you're interested in. And for us here at USF, our ultrasound experience is very, I would say, robust. And like was mentioned previously, we always do all of our procedure numbers. We have no issues with meeting those. We get all sorts of anatomic guided injections. You get all sorts of ultrasound guided injections. We have at least 4 months of this. We work on diagnostic ultrasound. We do the injections, predominantly peripheral joints and nerves. We do different PRP injections as well. So here we get lots of experience in the clinics doing ultrasound. And if that's something you're interested in, or the sports medicine realm, this is going to be a very solid foundation for your training in that regard as well. We also have the USF Morsani Clinic and Concussion Center. This is where we see kind of more of the outpatient follow-up care for usually the mild TBIs, but any long-term complications from those injuries, this is where we see and manage those. And so a lot of your outpatient, again, bread and butter, TBI management, you'll get to see here. This is predominantly with Dr. McCarthy, our program director. She has a lot of experience in this realm. So this is an area that you'll get to see and establish some foundational knowledge in that regard. We also have multiple rehab research labs that have been developed recently. And you can look at all of those different labs there. I won't read them to you, but there's a wide variety of different learning opportunities if you want to seek those out. And the last thing for me is what we lovingly call the CAMLS, the Center for Advanced Medical Learning and Simulation. This is a freestanding learning center that is dedicated entirely to healthcare professionals. They've got simulation, a lot of simulation-based stuff. So these simulated clinical environments, surgical skills labs, operating suites, really a chance to get in and kind of learn different procedures and different things in a very hands-on way, while in a very safe and controlled environment. Us in particular, we focus on more of the cadaver side of things, where we can practice our ultrasound skills, practice our injection skills, our anatomy. This is usually in partnership with the USF Pain Program. However, we certainly have opportunities to schedule and be involved in other learning courses if that's something that we wish to pursue as well.
Okay, I'm gonna try and get through some things so we can get some questions at the end here. So as far as call schedule goes, just like in most programs, the further along you progress through the years, the less call you're gonna take. We take call at home starting at 4:30 p.m. up until 8 a.m. the next day. As far as the weekends go, you'll be covering 4 floors: the traumatic brain injury, general rehab floors, spinal cord injury floor, and a chronic pain floor at the VA. And this usually ranges between, let's say, 30 to 60 patients or so, give or take. And that will go from Friday until Monday morning. As far as didactics go, we have protected time every Thursday afternoon. We do didactics typically at the VA, but we do it sometimes at other places, just depending on which lectures we have. The residents run journal club. We also do an MSK lecture series and sometimes just give random lectures here and there, depending on the situation. You can go ahead, Matt. I'll go
Sorry,
next.
I
As
didn't
far
mean-
as that's all right. As far as fellowships go, we have interventional pain fellowship at USF, spinal cord injury fellowship. I think we actually just got one from Carolinas, if I'm not mistaken, or UNC, and then an amputee fellowship and TBI as well. And on the next slide, we can see kind of where our fellows or where our last seniors and from the previous years have went. Last year, we had 2 match into pain at USF, and 1 went to a private inpatient group, and you can kind of see the rest there, split between spinal cord injury, interventional pain, sports and spine, and kind of private outpatient or inpatient rehab. So probably arguably the best part of coming to USF is life in Tampa. If you like sports, of course, we got sports, go Bucks. And the Lightning, although they didn't win it this year, we've been doing pretty good. Rays have also been doing pretty good as well. If you're an artsy person, we have the Straz Center, which is great performing arts. We have some of the best beaches in the world: St. Pete, Clearwater, Siesta Key beaches. You can Google it; you'll see yourself. Orlando is just about an hour northeast of here, not too far away. If you want to see Disney World, Universal, we also have Busch Gardens, our amusement park here in Tampa. As far as where the residents typically live, those who are married or have families typically live in the north side, where there's more suburban and a little quieter, while those who are single typically live down south, closer to the city, where there's a little bit more action. And then as far as kind of outdoor activities, I mean, it's Florida, so there's a lot of fishing, a lot of water sports, a lot of activities in that nature. And then we have just kind of pearls locations like Armature Works or Sparkling Wharf, which I know mean nothing, but they're very nice locations to hang out on the weekends. Move on, Matt. We can go on. So for frequently asked questions, our cap is 14 patients. On the rehab floors, our board rate has been 100% over the last 7 years. On call, as I said earlier, you're covering 4 floors, and we do that at home. We do teach didactics. As I said earlier, we have our own resident-run journal club, as well as kind of an MSK lecture series. And then, as Stefan had said earlier too about procedure numbers, it's never been an issue for us. During that ortho rotation on intern year, I know I crushed out 195 peripheral guided injections or peripheral joint injections, landmark based. So we definitely get our numbers. USF recently increased our vacation days to 20, which we're very happy about. You can moonlight as a PGY too, and we do have a board review course, which the program does pay for. And then, those are contact info. We got a couple minutes for questions before we move on. Anybody? And you can see our Instagram there if you want to reach out to us through there, or you can reach out to any of us or our program director. Let's see. How easy access? Go ahead, Matt.
So we got one question: how easy is access to Camel's lab? That's from how I understand it. It's pretty much where it's readily available for us to access if we want it. I think we did something there last year, but it's there. It's not hard to access. Is my point. How many PM&R cancer attendings are there? So we actually have one new one who's just starting. She was the amputee fellow at the VA, and now she's actually starting a cancer rehab there too. And I believe our attending Dr. Stanley, who runs our general rehab floor, he's trying to work in some more cancer rehab patients as well.
Stephen, just to add on to the cancer part, we do work at Moffitt, where you're going to rotate with a lot of cancer attendings or associated with cancer and that sort. Sorry.
How many residents? There's 3 in each class. How much exposure do you have in peds rehab? Does the on-call resident cover peds as well? You don't cover peds when you're on call. We do 2 months of peds, 3rd year, and 2 months our 4th year, I believe. Maybe give or take 1 month the other way. We work in both inpatient peds rehab and also peds outpatient. So we get a good bit of peds. We do that at Tampa General. Is there dedicated research support available to residents? Kareem, you,
Yeah. So one of the previous PM&R attendings, Dr. Latleaf, is now head of research or like second in command of research at the VA. So she kind of has like a shoe in for us. So if you have kind of anything you want to run by her or like as far as grants and all that kind of stuff go, like USF has so many resources to follow through with that. And then having Dr. Latleaf so high up in the chain of command, especially at the VA, where you can get a lot of information from a lot of different areas, is a great thing for us in regards to research and research support. So yes, there's a ton of support.
so I know we're out of time, but I'll stay on for 10 minutes or so. If anybody has any other questions in the chat, I can answer them. But our emails are up there too, so feel free to reach out at any point if you have any questions about the program.
All right, thanks so much, the USF folks.